After the first successful kidney transplant in 1954, just a few years later, the heart, liver, and pancreas were successfully transplanted. And just 20 years after that, in 1980, the lungs were transplanted. Hello, Homo sapiens. It's time to take a deep breath in and a deep breath out, because we're going to be talking about the lung transplant. The lungs are the large organs that exist inside your chest. They're also protected by the ribcage. Your lungs, each lung feeds into a bronchi. These bronchi converge to become a trachea, and above the trachea lies the larynx, which is also known as the voice box, where your voice comes from. Inside each lung exist millions of tiny air-filled sacs called alveoli. These alveoli help increase the surface area of your lungs so that air, like oxygen and carbon dioxide, can diffuse and infuse into the blood very freely. Around these sacs exist capillaries, lots of them. These also help in the diffusion of gases. If the alveoli are damaged enough, the whole lung might need to be replaced, transplanted. Nowadays, there are three main causes to alveolar damage. The first of which is lifestyle. Daily habits or activities that you do might impact the alveoli's ability to do its job properly. Lifestyles such as smoking, secondhand smoking, which is smoking without actually smoking yourself, drinking, drug abuse, a bad diet, old age, and air pollution are the major causes of lifestyle alveolar damage. The second way the alveoli can get damaged is through chronic conditions. Conditions such as asthma or chronic obstructive pulmonary disease, shortened to COPD. These two diseases can constrict the lungs' flow and break down the alveolar walls. Finally, the third most common way alveoli get damaged is through physical injury, such as when you get into a car crash and your lung gets punctured or you get compressed in the rib area. This causes the alveoli to burst, and this would definitely need a transplant. But how do the doctors actually transplant your lungs? Well, once you're placed under general anesthesia, they will start creating a large incision just above the breastbone, and then lift your skin up, move your ribs out of the way, and cut open your pericardium. Then they will observe your lungs and check if there are any perforations or tumors or anything that may cause a disturbance to the surgery before continuing. After that, your heart's pulmonary artery and vein will be connected to a machine so it can function without the use of the lungs. The lungs' bronchi will then be snipped and it will be taken out. Then, the new lung will be placed inside the chest cavity. Its bronchi will be sewn. Then, carefully, your pulmonary arteries and veins will be sewn back onto the lung. But before they close you up, they will place several drainage tubes inside your chest so that your lungs don't fill with fluid while they're healing. Finally, they will close up the pericardium, they will put the ribs back in place, and they will sew your skin shut. Healing after a lung transplant usually takes 7 to 9 weeks, and after that, you're going to have to go through respirotherapy so that you can learn to breathe normally using your new lungs. But throughout your lifespan, you'll have to constantly take immunosuppressant drugs so that your body does not attack your own lung.